Welcome. This is a quick little demonstration on a treatment with Graston Technique for a patient. This patient, Miss C, has had a total knee replacement. As you can see on her left knee, this is 2 weeks. She is now in the subacute stage. I was just informed that she's had these staples removed right along that scar line, as you can see. Very obvious, there's quite a bit of edema and swelling, quite a bit of heat emanating from the actual knee itself. The edema wraps all the way around, and she's complaining of obviously lots of stiffness, lack of range of motion. She can hobble around and weight bear, but not a lot of flexion extension movement at this point. The staples have just come out, and this will be the very first treatment for this area post-surgical at 2 weeks. So for those of you guys who are watching regarding Graston Technique, I'll show you a quick little demo and an approach to treatment of an injury such as this. So starting with GT2, bit of emollient. So because of the sensitivity and the freshness of this injury, we are keeping the treatment to a bare minimum, very light, very gentle. And what you'll notice is I'm avoiding that scar right down the midline completely. Okay, so we'll start with a little bit of a brushing technique. At any time, if the patient complains of severe pain symptoms or discomfort, please just let me know. So again, you can see with the emollient, we're just doing a light brushing technique right alongside the scar. So far so good?
So good, it's good, yeah.
So let's see how much flexion we have. How's that?
We're good.
Okay, good. So in slight flexion, I'm going to use GT2. It's got that double bevel concavity. It fits right around there. So again, the idea, having a free hand, I'm able to stabilize and treat along each side of the scar, both medial and laterally. We'll go inferior and superior. Again, this is just a very light brushing technique. I'm using that angle of the instrument along each side. So moving on, I would obviously do that quite a few times on both sides, using GT3 now. Again, the sutures and the staples in this case have been removed. What I'm doing is I'm using GT3 and I'm blocking with the opposite hand to try to encourage, drop your leg a little bit. So we're going to actually go in there and we're going to try and lift the scar. You can see the tissues come together. How's that for discomfort?
We're good.
Still good, okay,
Yeah.
Perfect. So again, both sides, and here, blocking, bringing the tissues together. You can see it's scabbed up in the middle. Again, we're not going directly on top of the scar. Okay, and we would work all the way down and through there as well. On video, hopefully you guys can see the increased edema that's in that area, or not so much the edema, the erythema, the redness response, and that's actually an okay thing. Why? Because we're increasing capillary perfusion and blood flow to the air, which for a scar and a trauma like this is actually a good thing. Part of the scar tissue protocol also includes blocking with a GT4, and again, instead of using my finger to block, I can actually use the free edge there of GT4. Again, following along that line. I can switch it around. Block with GT4 on the lateral side. And I would come up and underneath. Probably feels okay, right?
Yeah.
Good.
It's almost massaging.
Yeah, yeah. So oftentimes the patients will report that this is not really uncomfortable, it almost feels therapeutic. As this is a shortened demo treatment, I'm not going to go through the entire protocol, but the last thing I would do with this patient, again, keeping in mind this is treatment number 1, 2 weeks post-surgical, subacute stage, lots of pain, lots of reduced function and swelling. What I'm going to do is I'm going to incorporate some GT2 dynamic moves. I don't know if you can zero in on here. You can see that undulation right there, that swelling that's right in there. So I incorporate dynamic movements. So straighten the knee and nice and slow. I'm going to get the patient to flex her knee to her comfortable end range. So, right. How's that?
That's good.
That's about it?
Yeah.
Good. And then again, notice that I'm proximal and lateral to the scar, not directly on top of it. Okay, you can see the crimpness of the swelling that's in there. And I would do that again, repeat it on this medial side as well. So that would be my first treatment approach. On the next session, be it a week or 2 weeks from now, very similar approach, brushing to start, sweeping around the actual scar itself, and then moving in through some dynamic strokes. And maybe by then the swelling will decrease, we can actually get more flexion, extension out of her. That would be my approach using Graston Technique for TKR, total knee replacement, 2 weeks post-surgical.